Okay, this is the case study for Jane, an adolescent weight management presentation. Patient introduction. Jane is a 14-year-old female referred for weight management. She has a history of steady weight gain of 10 to 15 pounds annually for the last 6 years. Family history, both parents do struggle with obesity. Her father struggles with type 2 diabetes, and her mother is diagnosed with hyperlipidemia. Jane's recent labs show pre-diabetic markers with elevated LDL levels. Some contributing factors to Jane's situation: she does struggle with food insecurity, her and her family. Her dad does express concerns about running out of money towards the end of the month, and this leads them to make poor decisions regarding their nutritional health. They do rely on fast food, and she also does have a genetic predisposition. When both parents are obese, risk increases to 10 times compared to children with normal weight parents, and genetic factors do account for 40 to 70% of variation in BMI among individuals. Her clinical assessment: her current BMI is 28, which is over the 95th percentile. Her height is 62 inches. Her weight is 152.9 pounds, and her blood pressure is 125/82. Nutritional assessment: her estimated energy needs is somewhere between 1,800 and 2,200 calories per day. Using the Mifflin-St. Jeor equation, recommended energy deficit of 250 to 500 calories per day. And her macronutrient recommendations are protein at 1.2 to 1.5 grams per kilogram of body weight. Carbohydrates are going to account for 45 to 50% of total calories, and her fat will be 25 to 35% of total calories, with less than 10% of that coming from saturated fat sources. Jane's current dietary analysis: her current intake is somewhere around 2,900 calories, which puts her at a 700 to 1,000 calorie surplus on a daily basis. She is consuming around 92 grams of protein per day. 39% of total calories is coming from fat, and 13% of that 39% is coming from saturated fat sources. 48.5% of total calories are coming from carbohydrates, with 20% of that coming from added sugars. And her sodium is averaging around 3,680 milligrams per day, where she really should be at a target of less than 2,300 milligrams daily. Some key observations of her current diet: it's a very high consumption of sugar sweetened beverages. She does consume fast food meals frequently. She has very limited fruit intake, very minimal vegetable intake. She has excessive added sugar consumption, and she has a very high saturated fat intake from fried foods, processed meats, and desserts. Some nutrient deficiencies that I found in Jane's current diet are fiber, calcium, vitamin D, potassium, and iron. For fiber, she's really only meeting 44% of her recommended 26 grams. For her calcium, she's only meeting 59% of her recommended 1,300 milligrams. For her vitamin D, she's meeting about 19% of her recommended 600 IUs. For her potassium, she's meeting 41% of the recommended 4,700 milligrams. And for her iron, she's meeting about 80% of her recommended 15 milligrams. So my treatment approach with Jane is going to be prioritizing behavior change over extreme weight loss and aggressive weight loss procedures. I want to recommend the SMART goals approach, which includes the specific, measurable, achievable, relevant, and time-bound specific goals. This is going to include limiting sugar-sweetened beverages to less than one per week. I want to increase her fruit and vegetable intake to 5 servings per week. She should try and aim to prepare at least 5 family meals at home per week. and incorporate 60 minutes of physical activity per day. And she should aim for stable weight for 3 months, and then after that, aim for a gradual reduction in weight. I also want to recommend self-monitoring strategies such as food journaling, step counting for physical activity, promoting regular meal times, and portion control. Some dietary interventions for Jane. She really should replace sugar sweetened beverages with zero sugar seltzer or water with lemon to kind of keep the flavor. She should substitute whole grains for refined grains, replace fried foods with baked or grilled alternatives, add beans and legumes for protein and fiber. She should aim for 2 cups of fruits and vegetables per day. She should include lean protein sources such as chicken, fish, pork, and legumes. She should incorporate low-fat dairy products such as low-fat cheese and yogurt. And when she does have to have fast food meals, she should choose the grilled options. She should avoid fries, and she should select zero sugar beverages. Some food assistance recommendations for Jane and her family. Jane should continue participating in the school lunch program. This is going to give her about a third of her recommended dietary allowance, and it's going to act as a strong protective barrier against excessive weight gain in adolescents from food insecure households, which Jane is from. She should apply for SNAP benefits as well as her family. This can increase family food budgets by up to 30%, allowing for healthier food choices. Applying for SNAP benefits will also significantly improve the dietary quality of their diet with more fruits, vegetables, and whole grains compared to eligible non-participants. And Jane and her family should really utilize local food banks and pantries to help them fight against food insecurity, especially towards the end of the month when funds are running low. So this is her 3-day meal plan. You'll see a lot of these meals are not only nutrient dense, but very easy to prepare. They're also very tasty and creative. A lot of these meals are going to offer Jane a lot of micronutrients, a lot of fiber, and they're also going to put her in a caloric range that will benefit her weight goals. So this is her day 3 meal plan, and we can see a lot of foods and a lot of ingredients are coming from whole food sources, very minimally processed, a lot of water, a lot of fruit, a lot of fiber. We're really prioritizing fiber and protein throughout this meal plan. Some key elements addressed. Her caloric intake is going to be around 1,500 to 2,000 calories per day, which is reduced from her current 2,900. It's going to offer a more balanced macronutrient profile. It's going to target micronutrient deficiencies. It's going to provide higher fiber content and lower sodium content. This meal plan also accounts for school lunch program participation, but also includes weekend lunch options. This meal plan is going to drastically reduce added sugars and saturated fats from Jane's diet, and it's going to include minimized processed foods as well. Specific nutritional benefits from this meal plan and the foods that are included in it. This is going to increase vitamin, mineral, and fiber intake through adding whole grain food sources such as oatmeal, whole wheat bread, and whole wheat pasta, fresh fruit such as bananas, apples, berries, fresh vegetables, dairy products such as low-fat milk, yogurt, and cheese, and lean protein such as chicken, turkey, tuna, and beans. Some practical advantages for this meal plan include the fact that it's easy to prepare, it's relatively inexpensive, it's very tasty, nutritious, and family friendly. Cost saving recommendations were also thought of when thinking about this meal plan for Jane, and we're going to recommend her and her family to purchase seasonal or frozen fruits and vegetables at a discounted price that offer the same micronutrient content. We're going to recommend them to shop at discount grocery stores, incorporate affordable protein sources such as beans and tuna, and use ingredients that can be purchased with SNAP benefits. Some behavioral adjustments for Jane. We want to recommend regular meal schedules, so 3 meals plus a few snacks every day. We want to practice portion control. We want to practice variety within her diet to prevent boredom. And we want to balance nutrition with palatability for, an average teenager to make sure that Jane sticks to this diet plan. Some long-term goals are going to include addresses immediate nutrition deficiencies, whether it be micronutrient deficiencies with fiber, vitamins, minerals. We want to support gradual weight gain management, establishes healthier eating patterns, and provides a sustainable approach rather than a restrictive diet with an aggressive weight management